Hello, my name is Chu Zhang. I am a Doctor of Nursing practice student at Bradman University. I have a plan to start a clinical project at a primary care setting that would improve the care for patients who've experienced strokes and currently have depression. As a family nurse practitioner for 6 years, I've primarily worked in emergency medicine. And in the emergency department, it is crucial to quickly identify anybody with strokes and to be able to take care of them immediately to get them to where they have to go. That's very crucial. Those patients are generally under very high stress, and also their family members are having a lot of anxiety over their symptoms and not understanding what's going on with them. Those patients who have strokes are either admitted or they're transferred to any higher level of care. And those patients often, many times, I see them return to the emergency department for complications of strokes, sometimes due to psychological reasons, such as the inability to cope with their diagnosis, their physical ailments, or cognitive decline. That can be a side effect of the stroke. Complications can lead stroke patients to experience depression, and it can affect mortality, recovery, quality of life, and neurological outcomes. There are many different types of tools in medicine to help diagnose depression, but there's not one specific tool for patients that have suffered strokes. So in general, we're going to talk about something that will be used in the general public versus just for stroke patients. Some strokes are severe and can interfere with one's speech or cognition. For those who are able to maintain their speech and cognition, we generally use the test PHQ-9, which is a patient health questionnaire. There are two different tests. There is a PHQ-2 and a PHQ-9. And the PHQ-2 is a very brief, few questions assessment of depression, and the PHQ-9 is more extensive and has more questions included. The PHQ-9 is an easy tool that can be helpful in identifying early signs and symptoms of depression. In a mobile app called the Simple Depression Test. The Simple Depression Test is a mobile app you can get on your phone or any device such as a computer or anything like that. And what it does is it delivers a PHQ-9 almost in a text type questionnaire where you can click any questions of your choice, answers of your choice, and it also has a one-page very specific for the PHQ-9 that you can go through and answer if you want all the questions in one page. There are many types of different stakeholders that are involved in the proposal. There will be included would be the medical assistant, who I'll be referring to as an MA, and the nurse, such as any licensed vocational nurse or registered nurse, that will be just referring them as nurses, and providers such as nurse practitioners, physician assistants, medical doctors, and mental health providers. The medical assistants and the nurses' role in the care to help these patients is to help them download the mobile app Simple Depression Test and obtain the initial PHQ-9 with them in the office. The nurse will then review the results and identify the group that scores in the range of moderate to severe depression. The group of patients will be scheduled a provider visit by the nurse, and the provider will then evaluate the patient and assess if there is any treatment needed for the depression, or if they just need more education, or they need to be referred to mental health services. And the provider, which is the nurse practitioner, physician assistant, or medical doctors, would then refer the patient as needed. Then each stakeholder is identified to take a great part in the project, and they will be prompted by the project director at a 3 and a 6 month interval. The educational needs is for each group to have to start with the MA. The MA will be proactive to ask the patients on the first follow-up appointment after their strokes to see if they would like to participate in the program. And once they're determined to be a participant, they will be aware that they may be able to opt out at any time, just up to them. Once the MA does record that the patient would like to start in the program, they will then contact the project creator who will start the data collection and record keeping. The is also taught to download the mobile app and educate the patients about the PHQ-9. So they will be also educated about what the PHQ-9 is, what the questions are, so they are familiar with describing this to the patient. Along with that, the MA will ask if the patient has access to a mobile app. If they do not, then they will be prompted to receive a mailed out PHQ-9 questionnaire that they can return in a return envelope to. The return envelopes and everything like that with PHQ-9 questionnaire would be about 3 months and 6 months with entry into the project, because everybody's time frame would be a little different. It is important to review the PHQ-9 questionnaire with the nurses also. This is just to educate them about what to ask and what type of questions they can educate the patient about what they would be expecting. The nurse should also be educated on different levels of depression that is set up at the earliest appointment with the patient. And anybody who scores at a range of moderate to severe depression would then just get an appointment with the provider to be seen and assessed for their depression. Additionally, there are no training for any of the providers or mental health workers, as they are well aware of how to treat depression in general, and if this is just a knowledge deficit or if this is something that requires medication or any cognitive behavioral therapy. The theoretical foundation and conceptual framework for the proposed intervention comes from Dorothea Orum's self-care theory. The self-care theory emerged from Orum's request to determine why the patient need a nurse. And Orum's review all needs in the patients may have related to primal needs of food, excretion, environment, and then expanding to recreation, intellectual needs, physical needs, close relation contacts, spiritual, and religion. When a person has an illness and not able to control many things around them, such as somebody who suffers from a stroke, their self-care activities are modified and the patient becomes dependent on those around them for their self-care activities. So, for example, the patient would be very dependent on either their family members for, day-to-day needs, or dependent on the healthcare provider for medical needs or anything that they're not aware of. Many times, these stroke patients are dependent on others, and depression, if they are affected with depression, that is very debilitating, and that can even significantly affect stroke patients in a negative way. Depression can be debilitating for patients after strokes, and therefore delayed diagnosis of depression can hinder recovery and raise healthcare costs. And that's one big thing that we need to worry about readmissions and everything like that with those stroke patients. We can all take part in identifying early signs and symptoms of depression in stroke patients and improve quality of care by identifying early signs of depression and treating that immediately to help the recovery of those stroke patients.